Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Jennifer Garnica, who is the Vice President of Nursing and the Chief Nursing Officer at SSM Health St. Mary's Hospital, St. Louis, about how switching to a W 2 on demand staffing model helped address staffing issues. So, hi, Jennifer, how are you?
Hi, I'm great. Thanks for letting me join today.
Of course. Thanks for taking the time to be here. So let's jump right into it. Obviously, amidst one of the greatest nursing shortages in healthcare history, CNOs and other nurse leaders are facing a plethora of different staffing challenges. So, what do you think are some of the biggest staffing challenges in nursing today?
Well, there's a lot to choose from because there
Mhm.
is a huge shortage and significant challenges in staffing with regards to nursing. I think, first of all, post COVID obviously has had a massive impact on nursing and staffing. And really, that's driven from there's a lot of options out there now. COVID taught us that a lot of things can be done remotely. So we have a lot of telehealth. We have a lot of things out there outside of just acute care in the hospital, and that's very attractive to a lot of nurses. And so I think that the competitiveness of the market has only increased post COVID.
Mhm.
So that is a struggle because everybody needs nurses, and we're not only competing with hospitals, we're competing with all of those other venues as well. So that's certainly been a challenge. I also think just the market in general, post COVID for nursing is different. So
Mhm.
what used to be a very traditional nurses wanting to work a full time job or a part time job, and needing sort of that benefit platform, I think COVID also taught people that that isn't necessarily what they have to do. So people have moved away from that very traditional model of full time or part time. They're looking
Mhm.
for more flexible options. They're often getting benefit structures from other places. And so, again, that's a challenge for hospitals who traditionally had believed that your core staffing should be about 85%, very, very little contingent staffing. And we're having to really shift how we look at that because that's just not the market.
Absolutely, yeah. I think everything's changing on almost a day-to-day basis with staffing and nursing. So it's fascinating stuff. So, talk to me a little bit about SSM Health. How did shifting to a W-2 on-demand model help address those staffing concerns that you just listed?
Yeah, so I think our organization, my hospital, as well as probably most hospitals around the country, had to quickly shift to other staffing models when COVID came and the pandemic came out of just pure
Mhm.
necessities to survive, right? Most folks were using external or third party agencies, which of course are contracted service. Most often, those nurses are coming from far away. You're not usually
Mhm.
using local support. So, nurses are taking usually a 13 or 16-week contract. They may be, I'm in St. Louis, they may be coming from Florida or from California or somewhere pretty far away. They're doing their contract, they're exiting. And that creates, although a short term solution, you have a staff and a nurse at the bedside, it creates some long term challenges, not only with
Mhm.
cost, but just around longevity, loyalty, sustainability for outcomes. So we really switched to look at what an on-demand model might look like. We've partnered with ShiftMed, and for us, that partnership is really important because they truly are a partner. So having a partner that shares your vision, your mission, your values, wants the same outcomes as you. And that
Mhm.
really turns then into a staffing model that is a long-term solution. It's more cost
Mhm.
effective. It helps with regards to being able to flex those nurses as needed. So rather than having a 13 or 16-week contract with a nurse, which you may have that need, you may not have that need as things are changing in your hospital. An on demand model gives us really the ability to adjust our staffing needs very quickly, use
Mhm.
nurses when we need them, flex them maybe off or to other areas when we don't need them. So that gives us a lot of flexibility. It also created, again, a lot of sort of loyalty and longevity with these nurses. They're local nurses. St. Louis is a pretty small town, believe it or not. So everybody knows each other. Healthcare is a small world, and so
Mhm.
generally you're getting local nurses. So they're from the area. They work in other markets around here. Folks know each other, so it's nurses have those relationships. They're helping to sort of recruit and sustain one another. So that breeds again that loyalty and longevity. And you really get into kind of a situation when you're in a dual job interview for some
Mhm.
length of time. So you're getting this wonderful on demand support that they understand the market, they're there to support your ministry, they have relationships with your own staff. And then again, you have the opportunity to really kind of attract them to be hopefully a permanent part of your organization.
Absolutely. Yeah, it always helps when, everybody knows each other. Because then it's like a
Sometimes.
yeah, sometimes I guess yeah, it could help or hurt for sure. Um, yeah, so, walk me through the process of converting the on-demand employees to full-time staff. How did you start that?
That's a great question. Looking back on it, I feel like it maybe would have sounded like a huge lift, but it really worked
Mhm,
very seamlessly. I think the first part was helping, first of all, to help our own staff understand why we were making the change, right? Why we wanted to
mhm,
shift from using that traditional agency model, and that third party agency to really having a partner with an on demand um, company. ShiftMed again as our partner. So just helping our staff understand why we were making that shift, and then
mhm,
engaging them in the process, I think was probably one of our biggest success, because really, again, they are our best recruiters. So really, nurses don't want to work short staff. So when you talk about the
mhm,
why and our goals to make sure that we have staff at the bedside, that our patients are getting exceptional care, and how do we think we can best do that, engaging them in that process and helping them sort of be part of that lift, I think was huge. So we had a lot of conversation with our own staff, a lot of sort of tools that we gave them around as we welcome and onboard those folks, what our expectation was, how do we sort of wrap our arms around those nurses who, again,
mhm,
many of them we know we've had relationships with, maybe they had worked here in the past years ago. What would that look like? And again, building those relationships and really asking our staff to help us recruit those folks on board, help them understand why SSM and St. Mary's is an amazing place to work, why we would want them to be a permanent part of our team, what that may look like, helping them
mhm,
find a match. We offered some unique PRN options and things that we thought would be a nice complement for those folks. And again, I think our conversion, I'll call it, of those nurses to onboard to our own staff, really, I would credit our nursing staff. They really were our best
mhm.
recruiters. So it was really getting them engaged and involved in the process that I think was most helpful.
Absolutely. And what was kind of the thing, I don't know if you maybe polled some of them or what, but, what was the thing that made them kind of take that final step and make that decision to come on full time?
Well, I would like to say it's because we're just so amazing they couldn't say
Mhm.
no.
We
But
could go with that.
right, I do think I think there's a lot to be said for when you're being recruited from a peer. So I
Mhm,
think, first of all, it's not scary to make a leap when you get to try it out. So I think, again, that dual job interview mindset was really, really helpful, because I know for myself, I can see a job online and I may be like, oh, that sounds really wonderful. Maybe I even go interview, but it feels really scary. You don't know if you're really
mhm,
going to like it. Maybe you're in a place you've never been or you've never worked there. And I think there are sometimes that leads folks to be like, I'm not going to make the switch. I'll just stay
mhm,
where I'm at. And nursing, it feels like it's the same everywhere. Why make a change? And I think in this model, again, when you have folks that get to come be a part of your culture, be a part of your hospital, be a part of the things that you're doing, in an ongoing basis, most of these nurses work pretty consistently at some of the same places, and so they do get really part of your own team.
mhm,
I think it makes it a lot easier because that jump isn't scary. And they're like, oh, I didn't realize it was so great here. Gosh, I really love it here. I love how you do this, or I love being a part of this. Then you start having some different conversations about, well, if you love it here so much, here's some options for you. Here's
mhm,
things we have that may be attractive to you. Here's the different positions available, the different scheduling. Here's benefits around clinical ladders and sign on bonuses and nurse practice councils, and things that are attractive to nurses. And I think that's a huge part of why you can get people to come on board, right? And then you've got your peers saying, yeah, I've been here for 20 years. I love it. I would never leave. And
mhm.
again, it doesn't feel scary anymore. And it's pretty easy to make that transition. So
Absolutely. And how have the core staff who were doing the recruiting, what's their reaction been like?
it's been really positive. I think, first of all, they are really proud of themselves.
Mhm.
So we would
Yeah.
update them, obviously, on folks that they were able to help get moved over. So, if they had a peer or a friend that was working an on-demand platform and decided to come over and be a permanent part of the staff here. I think there's a lot of pride and excitement in that.
Hmm.
So that was one thing. I also think, again, relationships are so important. Everything we do is really about relationships, and so I think, not that they wouldn't build relationships with an external agency that lived in Florida. It's a short-term relationship, and sometimes that
Hmm.
connection is not quite as deep. With an on-demand partner, again, these folks are here with us pretty frequently. They get to know the staff, and so there's not that rub of just the sort of stranger coming in. And although you're thankful for their help, you really are. It just is different than, oh, this is
Hmm.
my friend, and they're working here, and I really love working with them, and I'd really love for them to work here all the time, or I'd love for you to be my charge nurse, or gosh, we have this opening. And so I think
Hmm.
there was a lot of positive and excitement around feeling like they were part of a staffing solution versus feeling like you're kind of a victim, right? When you're short
Hmm.
staffed, it's really easy to fall into a victim mentality of just, it feels hopeless sometimes, and what are we going to do? And I think this enabled them to feel like they were part of the solution. And I think that always feels good.
Absolutely, yeah. And just to kind of put a concrete number to it, if you have it off the top of your head, how many nurses have you converted to full-time staff?
I have lost count. I know for sure it's over 100. So
Hmm.
I think that it's probably more than that at this point. I think I stopped counting. But I
Hey,
know
that's a good problem to have, though.
that's a good problem to have, right? We continue to have that funnel as again, our on-demand partner ShiftMed is their onboarding and creating bigger pools. We're continuing to funnel those pools over, so it's a,
Mhm,
it's a wonderful pipeline that serves sort of twofold. It gives us the
mhm.
in the moment staffing relief, but it also gives us that recruiting pipeline, which is amazing. So it's at least over 100. I probably need to get an updated quote one of these days. So we just want them to keep
Absolutely.
coming though.
Absolutely, yeah, yeah. So, speaking of numbers, for our CFOs who might be watching, what are the financial benefits of using this
Oh
strategy?
my goodness, they are enormous. The CFOs will love to hear that. But
Mhm,
really, truly, it's. I think looking at areas of turnover and retention. Obviously, that's a really high cost business when you're bringing
mhm,
folks in and you're turning them over. Recruitment in general is expensive. Just looking at sign-on bonuses and training and onboarding. So anytime we can reduce that turnover rate, we're obviously going to save money.
mhm,
I would also say even an orientation period. So that's an expensive, again, onboarding and training. When you have an on-demand partner
mhm,
whose nurse is onboarding, they've probably already been working at our hospital for who knows, months, maybe a year. So that onboarding is much quicker because
mhm,
they're really already pretty acclimated. So that certainly is a cost savings there. Um, External agency contracts. So those
mhm,
we all know are very expensive, and so those rates are obviously much better
mhm,
when we're working with an on-demand partner. So there's savings there as well. Um, and then I think you certainly have a lot of other savings you could calculate around when you stabilize your workforce when you talk about outcomes. So we can
mhm,
easily look at we've had significant improvement in HAI experience in those areas because we don't have such an unstable workforce anymore, right? We treat
mhm,
these folks as our own. They are part of our staff. We embed them in our culture. Again, ShiftMed's an amazing partner. So anytime we roll out a new initiative or we've got to have, practice conversations, they're included in that as well. So that staff always know sort of
mhm,
what's happening at the hospital level. And so again, you can see those improvement in outcomes, which
mhm.
again is equating to saved dollars because you're not having infections or you're having better patient experience. And so I think that's a benefit, and then just overall productivity as well. It's much easier to manage with an
Mhm.
on-demand. They work very similar to PRN staff, so you're not under a contract where you can't flex them. It really is, hey, we needed you today, thanks so much, loved that you help us out. Tomorrow we don't look like we need you, and so then
Mhm.
you're only really spending the expense when you need it and not just all the time to have it just in case.
Just in
So
case, yeah.
lots of savings. Yeah.
Yeah, it sounds really like a win-win for everybody involved, even patients. I imagine it's nice to have, like, a consistent nurse staff that isn't
Mhm.
always going in and out of the hospital and everything.
It's been a very positive experience for us. It really has been. like I said, we can talk about loyalty and longevity,
Mhm.
but I think the morale just in general. Again, when you stabilize the workforce, when nurses come to work knowing that we're doing everything we can to get support into the building for them, and they've built those relationships, they know that that the shift med or the on demand nurses are their partners. There's a lot of positive energy around that.
Mhm.
There's a lot of ownership, and then people are excited, they're motivated, they're not feeling so exhausted. So the morale changes. The culture is much more positive around. Okay, we've got this. So, and again, they build relationships. I can't tell you how many of our nurses text or reaching out even to their on demand friends are like, hey, we look like we have a need tomorrow.
Mhm.
Go out there and pick up the shift. And so again, they're our best recruiters.
For sure. Yeah. Yeah, that does sound fantastic. And my last question for you is how do you think other CNOs and nurse leaders can take inspiration from this strategy and take it to their own health systems?
That is a great question. I would just say be open minded. I think
Mhm.
it's really hard for nurse executives or hospital leaders to sort of adjust our mindset.
Mhm.
Myself included, sometimes we get very stuck in again, you have to have 80% core and 20% contingency, and we've got to supplement with this type of staff. And I think we've got to really understand that the market has changed. I think you have
Mhm.
to meet people where they are. I think you have to sort of learn to live with staffing looks different than it used to. Those staffing models look different. But there are creative options out there. And I think, encouraging those partnerships, really working through relationship based care, so really, again, building those relationships, being
Mhm.
creative, not being afraid to engage the staff in decision making. They really know what they need, and they are huge partners in this. So I think just being open minded and engaging folks at every level to make changes that are a little scary at first, a little intimidating, but once you get going, again, you can see a lot of really positive outcomes.
Absolutely. Well, thank you so much, Jennifer, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening.
Well, thanks for having me.